Hi, this is Andrea Kane, and I am here again to talk about HIT 330. This time we're going to look at the Chapter 4 quiz. I went back and looked at the Chapter 3 quiz, and there were no questions that had more than 4 wrong on each of them. So if there's something specific about the Chapter 3 quiz that you'd like me to address, please shoot me an email and let me know, and I'll research it and get back to you. But I wanted to talk about Chapter 4. I had some feedback about that. And I think while I do this, one of the things I'm going to do is talk about ways that you can study to help yourself with these quizzes. So the first thing that everyone struggled with on the Chapter 4 quiz was the matching. And it looks like those terms were not necessarily covered in Chapter 4 as I thought they were. That came from the instructor materials from the book publisher. Those terms and their definitions came from there. But in looking back, I'm not sure that they really belonged. So I went ahead and deleted those back. So I will be crediting everyone with 8 points on Chapter 4 quiz right away for the matching. So know that you will get 8 points back automatically for the matching question number 1. All right, the next one that someone asked about is number 13, which now is number 5 since I've deleted the matching. This one has to do with federal conditions of participation. And if you look at page 97 in your book, it's at the bottom of the first column. It talks about how CMS dictates that the medical staff bylaws must address certain documentation requirements in the Medicare conditions of participation. The Medicare conditions of participation are the standards that a healthcare organization must meet to receive Medicare funding. And then it goes on to talk about H&Ps. If you notice, conditions of participation, or COP, are in a different color than the black text around it. If you skip back in the back to page 725 in your glossary and look at conditions of participation, you will find, and this is about midway down the second column, it's the administrative and operational guidelines and regulations under which facilities are allowed to take part in the Medicare and Medicaid programs. They are published by the Centers for Medicare and Medicaid Services, a federal agency under the Department of Health and Human Services. So what they do is they have these rules that govern hospitals that treat Medicare or Medicaid patients. Take part in the Medicare or Medicaid programs. There's nothing in there about acute care services, nothing in there about accreditation, and nothing in there about HIPAA. So when you're studying and you're going through and you're reading your chapter, when you come across these terms that are in a different color, I would suggest that you take a look back in the glossary and see if there's any additional information that you need to know. I also teach medical terminology, and what I have heard from some of my medical terminology students is that they like using an app called Quizlet to study instead of making traditional flashcards. So what you may want to do with some of these terms to help you study is utilize Quizlet. So I'm gonna just recommend, number 1, take a look at your glossary. See what additional information is in your glossary for these terms, and also use Quizlet or something like that, or flashcards, to help you memorize this information. So on this one, I understand you feel like you may not have studied this, but it was there. However, it did take a smidge of digging. So therefore, on number 13, I will give you half credit if you got it wrong. Okay? That would be only fair. All right, so the next one that looks like I need to go over is number 22. Okay. Looks like soap is the next one. So let's talk about soap and where it would be discussed in your book in good old chapter 4. Typically it's under progress notes, but we'll see if that's where they put it this time, because sometimes they put it in different places when they talk about it. Just a second here, I'm looking. Maybe further back than what I'm thinking. I thought it was up here with the rest of this stuff. But in the meantime, I can tell you, SOAP stands for Subjective Objective Assessment and Plan. And that term has been around for a long time, and it typically discusses the type of documentation that is being done. It's sort of the layout or the format of how typically a physician might use to document. I'm thinking I may need to put my glasses on because I'm missing it. Sorry, hang on just a second, I will find it. I guess if all else fails, I need to take a look at the index. Sorry. That would be fairly easy to find since it is in that chapter. Alrighty. Except it's not in there either. Alright. Always fun when this happens. I'm tempted to just go ahead and credit it back to you without, it's this difficult to find. Oh, sorry, it's right here. Page 116, bottom of the page 116. It talks about paper health record documentation. And this is where it goes into source-oriented health record, universal chart order, integrated health record, and then it goes down here at the very bottom, last paragraph in the second column under health information media. The subjective objective assessment plan SOAP method is used to construct physician progress notes. Physicians use the acronym SOAP to remember what elements of documentation must be included in a progress note. The SOAP methodology came from the problem-oriented health record, and then it goes into who developed it and all of that. So, if I look at this nice little paragraph here, it has SOAP as something that you can look up in your glossary, as well as problem-oriented medical record. So I'm not comfortable with crediting this one, but I will admit it is one that you had to be really looking for to catch and see. So I can see where it would have been a bit of a challenge. All right, so the next one is 23 that I want to talk about. A chronological report of the patient's condition and response to treatment during a hospital stay is known as progress notes. Okay, so let's break this down. First of all, you may not know it is progress notes. So let's look at the answers. The question is a chronological report of the patient's condition and response to treatment during a hospital stay. Is a medical history a chronological report of the patient's condition and response to treatment during a hospital stay? No. No, that's not a medical history. Not according to our handy dandy book here. If you're looking at page 104, it talks about the medical history portion of clinical data addresses the patient's current complaints and symptoms and describes his or her past medical, personal, and family history. Okay, so you know it can't be medical history based on the question text. All right, let's talk about physical exam. Is a physical exam a chronological report of the patient's condition, response to treatment during a hospital stay? No. No, if you go further down on page 104, the physical exam represents the physician's assessment of the patient's current health status after evaluating the patient's physical condition. So no, that one's not right either. All right, a physician order. Is a physician order a chronological report of the patient's condition and response to treatment during a hospital stay? No, 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 no. If you go further down, it talks about orders, that they are for tests or treatments that either prevent or address illness by the way of medication administration, surgery, or counseling, X-rays, CT, MRI, lab tests, or more for the purpose of diagnosing a patient's symptoms of diseases or symptoms of illness. So you know it can't be the first three, it has to be the fourth one. And if you look at, oh, and it goes further, physician orders are the instructions of the physician that the physician gives to other healthcare professionals who perform diagnostic tests and treatments, administer medications, and provide specific services to a particular patient. So going back to this, even if you don't know that the answer is progress notes, you're going to get there if you realistically stop and think about logically how could this be. And then if you go further in your book, page 107 talks about progress note. And it says that clinical observation, it talks about clinical observations, and it says that it is a chronological report of the patient's condition and response to treatment during his or her hospital stay. So I guess what I would encourage you to do is when you go to take tests, stop and think. If you don't know the answer right off, if you aren't absolutely sure and say, oh, I studied that, I remember that right off the bat, that's okay. But then what you need to do is go back and use logic to go through the answers and say, it can't be that one, it can't be that one, it can't be that one, so therefore it must be. So I'm not going to credit back on this one, just encourage you as you take your test to really look and think about these. All right, so the next one, that was 23, I believe. How about let's talk about number 33. So that would be nursing documentation. It should be what blank, nursing documentation should be blank, not based on the nurse's opinion. All right, so let's take a look at our book about nursing documentation, because I think if I remember correctly, when I was looking for soap, I ran across that. So let me see. Was there a nice section about nursing? Yes, there was. Let's see where it talked about. I think it was under clinical observations. And let's see. Where did it talk about that? This one I am willing to credit back to you because I know the information is in here, but it's probably not as crystal clear as it should be. But I do want to talk about it regardless. I'm not going to dig for the answer. I'll credit this one back to you, number 20 or number 33. I'll credit back to you if you got it wrong. Nursing, let's again go through this with a test-taking sort of mind. Nursing documentation should be creative, not based on the nurse's opinion. Do you think that nursing documentation for your personal medical record should be creative? I don't think so. That's really not what healthcare and professionalism is about. Do you want it to be subjective? The nurse's documentation should be subjective, not based on the nurse's opinion. Well, what does the word subjective mean? Subjective means in your opinion. So it can't be subjective as an answer because the last part of the question says not based on the nurse's opinion, and subjective means based on opinion, not on fact, not on logical things that have been, it's not factual, it's opinion. So subjective is as one person sees it through their eyes, and that would be opinion. So you can right away take out creative and subjective. Now I get that reflective and objective might be tough to decide between. Let's talk about that. Objective means there's no bias to it. It's very factual. It's not opinion related. Reflective means you're thinking about it. And reflective is actually a little bit closer to subjective. But I will give you the point on this. It really should be objective. All medical documentation should be objective, not subjective. There should not be someone's personal opinion involved. It should be based on what is actually happening, what is viewed, and that sort of thing. No personal comments, no personal opinions. All right, so I will give you guys that. And in the future, to make it a little bit easier for people, I'll go ahead and eliminate reflective as an idea. All right, so the next one, that was 33. Someone wanted me to take a look at 35. So 35, legal record. Legal health record is defined by who? Well, all right, let's take a look back at the beginning of chapter 4. It says, legal health record, page 100. It talks about legal health record. And it says that the legal health record is the documents and data elements that a healthcare provider may include. And then you can read on down from there. If you go into the next column on page 100, it says the current definition of the legal health record is complicated. Each healthcare organization must define what its legal health record contains. Now, I will grant you that the word defined is a little bit different than contains, but if you read the sentence, each healthcare organization must define what its legal health record contains. So the legal health record is defined by each healthcare organization. So this one was in your book. This one was in your book on page 100. So I'm not going to credit this one back because I feel like it was there in pretty clear black and white. All right, so the next one, 39. Oh wait, 38, sorry. All right, true statement regarding abbreviations in the health record. All right, let's talk about abbreviations. Good old abbreviations. In the healthcare world, abbreviations can be the bane of an HIM professional's existence, having been there and done that. All right, so what about abbreviations? I'm sure it's addressed here, or at least I hope so. All right, page 102. Page 102. Look at the fourth red dot on the left. Only abbreviations and symbols approved by the organization and medical staff rules and regulations should be used in the medical record. So let's go through the answers. If the book says that they can be, that only approved by the organization and medical staff rules and regs, does that say anything about Medicare? Does that say anything about the state? Does that mean that the physician can use any appropriate abbreviation in the health record? No, only approved ones. And who approves those? The healthcare organization and the medical staff. So I will add in here, and the medical staff, oops, not spelling well today. All right, so that clarifies it. All right, only abbreviations approved by the healthcare organization and the medical staff. And really, the medical staff, it's more of a rubber stamp afterwards, although they can make recommendations to add or delete. But they're the only ones. Physicians try to use any abbreviation they think is appropriate in the medical record. And the state doesn't govern abbreviations. Medicare makes recommendations, but again, they aren't the ones who tell you what abbreviations you can use. They will tell you the ones you should not use and the unapproved list, but they can't tell you the ones that are the only ones you can use in your record. So again, this one was in your book. I will give a half point simply because since I clarified the answers a little bit, I will go ahead and give a half point credit to anyone who got number 38 wrong. All right, let's talk about number 39. A blank is a summary of the patient's problems from the nurse or other professional's perspective with a detailed plan for intervention. Okay, so we're looking at something that's a summary of patient problems and a detailed plan for intervention. So it's a summary of problems with a detailed plan for intervention. Is a summary of problems and a detailed plan of intervention a procedure note? No. Procedure note is like an op note. That's something that you explain what you did. That's not a summary of the patient's problems and a detailed plan for intervention. A progress note, as we talked about, is really what's happening throughout their hospital stay. A clinical observation is not necessarily a summary and detailed plan. That's really just a care plan. So let's go back into your book and talk about where it talks about a care plan. And if you're looking at your book, on page 107, it talks about clinical observations provided in a progress note. So really, clinical observation and progress note are the same thing. A clinical observation is provided in a progress note. So once you rule out clinical observation, you can rule out progress note as well, because that's not the content of that. In terms of a therapeutic procedure note, that is on page 108, and it talks about how it's all these procedures. So it really talks about the procedures. It doesn't say anything about the other. So let's find care plan. and take a look at that. Care plan. It's right here on page 107. Sorry, it took me a second there. It's right across from the clinical observations progress note. If you look for the light green, it says often a care plan, a summary of the patient's problems from the nurse or other professional's perspective with a detailed plan for intervention may follow the assessment. So there you go. It's right there in black and white. Care plan. So on this one. And this one, again, I really feel like it was right there in your book. I would keep going back to the glossary. Whenever you see something in your book that's got a different color to it in the text, I would go to your glossary and take a look, as well as what's in the in and around the text. Okay, so next one. Number 40. The health record that captures the documentation related to treatment a pregnant patient received before giving birth. Okay, so this one's going to be a bit back to your medical terminology days. Let's start with postpartum. Okay. Oh, sorry, my mouse is kind of wild here this morning. This afternoon. See if it'll behave. Okay, so again, you're talking about treatment related to a pregnant patient before giving birth. Before giving birth is the clue to this one. Before giving birth. Obstetric just means that she's pregnant. Peri-delivery means around the time of delivery. So maybe it would be before giving birth, but it's around the time of delivery, and that's not what this says. It doesn't say in the question, it doesn't have any mention of being at the time of delivery or around the time of delivery. Postpartum is after delivery, and again, we said here it's before giving birth. Prenatal is before birth. If you think back to your medical terminology class, prenatal means before birth. And that's why this one is the right answer. But I'm willing to give you half credit on that since I had in there peri-delivery. And that could make some people, that could be difficult and challenging for someone. So I will take that out. But obstetric just means that she's pregnant. It doesn't mean that it's any particular time. This said before giving birth, which is the prenatal. All right. That is all I had that people were concerned about, except that then we went into questions which are now 33 to 42, but they would have been 42 to 50 at the time you took the test before I deleted the matching out, where it talks about the different documents. And this is where you really need to understand what they are and the kind of information they would have in them. So, for instance, that was history. This phrasing, I hereby acknowledge doctor provided information about the procedure, my rights as patient. You needed to know it was informed consent. Implied consent is where you show up at the ED. particularly if you're unconscious. If you're brought to the emergency room, it's implying consent that you want to be treated. If you're brought in by an ambulance, that's implied consent. You want to be treated. Even if you're not awake or alert, by coming to the hospital, it's implying consent that you want to be treated. If you're unconscious, that's the type of thing. This, what should have tipped it off as informed consent, is it's about a specific procedure. It talks about procedure. General consent to treat is not going to list any specific procedure. Implied consent is not going to list any specific procedure. That's how you know. An advance directive talks about what you want done if you are end of life or needing life support or that type of thing. Next one was this was, I have recommended to Mr. Patient that we proceed with CT scan of head to rule out bleed. Thank you for allowing me to participate in Mr. Patient's care today. Who would say that? It would not be in a history and physical report. You would not say that in an operative report or a discharge summary report. It's only a consultation report because the words here are recommending and allowing me to participate. That is not going to be language that is used by someone doing discharge summary, H&P, or op report. When you think about what those documents do and what they mean. Here's one. Disposition, no lifting greater than 15 pounds, no driving for 6 weeks, final diagnosis, coronary artery disease. Again, it's not a consultation report. You're not giving recommendations. You're not thanking them for the referral. It's not an H&P because you've got the words disposition and final diagnosis. It's not an operative report because, again, it's not saying anything about a surgery or procedure, so it's got to be discharge summary report. It's disposition. Where are you going and what are you doing after you leave the hospital? And final diagnosis is, what was the reason that you came into the hospital and received treatment? What was your major reason for that? What bought your bed? Okay, next one is a date. Admit via internal medicine, urinalysis, cardiac diet. Okay, so it's got a date and it says admit, urinalysis, cardiac diet. Is that a progress note? Absolutely not. It's not telling you how the patient's doing. Is it an emergency room visit note? No, emergency room physicians cannot admit patients. And again, this is not the type of thing that you would see happening in an emergency room visit. Emergency room visit is, you know, what's going on? How did you come in? What's going on? What are we doing for you? Anesthesia record? Nope. Anesthesiologists don't admit patients either. This has nothing about anesthesia in it. This has nothing about the emergency department in it. This has nothing about a progress note in it, so it has to be a physician order. If you think about it, it's telling someone to do something. It's saying admit this patient via internal medicine, do a urinalysis, and put them on a cardiac diet. They're orders. They're telling people what to do. All right, next one. Here we go. Time, temperature, pulse, respiration. What is this? Would a lab report have vital signs on it? Because that's what these things are. These are vital signs. Would a lab report, the results of a urinalysis or results of a blood draw, have vital signs on it? No. Would a pathology report, and that's looking at a tissue sample or looking for cancerous cells or those types of things, would that have vital signs on it? No. Would an x-ray report, someone who breaks a bone and they have an x-ray done, would that have their current vital signs on it? No. All the x-ray report's going to have on it is their demographic information to identify them and the film itself and the interpretation of the film. So would someone who comes into the ED to be seen, would someone take their vital signs? Yeah, that is one of the first things they do if you come into the ED once they get you signed in, is they're taking your vital signs. They're trying to see what in the world's going on. So that's where you would go with that one. Next one is, I understand I have a right to restrict the manner in which my PHI is used and disclosed to carry out treatment, payment, or healthcare operations. Okay, right away it says I have a right to restrict PHI. All right, which of these talks about protected health information? It's going to be privacy practices. Right away, it gives it away with PHI. Anytime you're mentioning PHI, odds are it has something to do with privacy. Privacy. Patient rights are about your right to be included in your treatment, your right to refuse treatment, those types of things. General consent to treat is, I'm here at this hospital and I'm saying I want you to treat me and I want to release my information to insurance so that they pay. Advanced directive is, again, end of life, advanced life support, things like that. Next one. Patient name, date of birth, patient gender, next of kin information. What kind of information is this? It's called demographics. So where would it be found? Most likely it's going to be on your demographic sheet. If it's demographics, it's probably going to be on that demographic sheet. Is next of kin typically on your discharge summary, H&P, or privacy practices? No. Your name would be, your date of birth would be, your gender might be, but next of kin information, that's typically only here on your face sheet demographic sheet because it's not needed to identify you on those other reports. All right, next one gives you a date, tells you the surgeon, anesthetic, complications, operation that was performed, specimens removed, estimated blood loss, discharged to PACU, and there's a diagnosis. So would this be a pathology report? No, it hasn't. This is not a pathology report. A pathology report goes over tissue removed and whether or not the kind of cells that they found and that sort of thing. So we know right away pathology report it cannot be. Is it a consultant report? Well, no, it doesn't say anything about referrals. It doesn't say anything about recommendations. So it's not a consultation report. Is it an anesthesia report? Does have the date, does have the surgeon, does have the anesthetic, but it has all this other stuff that has nothing to do with anesthesia, right? The only thing that it really can be is an operative report because it's listing everything, all the different things that you would want included on an operative report. So that's really what gives it away. All right, last one. This one, it talks about activity up in the chair. Person had a shower. They ate 2/3 of whatever meal they had. Their IV pump has been discontinued. Their family was at their bedside. They don't have any complaints. The dressing on their arm was changed, and now they're awaiting discharge orders. Would this be ED triage notes? No. Think about it. When somebody comes into the ED to be triaged, to be determined how quickly they need to go back and be seen by the physician, for instance, is this a heart attack or is this a cut finger or is this a strained ankle type situation versus is this shortness of breath and a possible heart attack? No, this talks about a shower. This talks about meal. This talks about family at bedside, dressing on arm change. None of that would happen in the ED triage. So you know right there and there it can't be that one. All right, why would it not be a therapy note? Well, think about what therapy does. Does therapy shower patients? Does therapy might note their meal, but do they talk about dressing on arm change, awaiting discharge? A lot of this information, if you think about it, has nothing really to do with therapy. If physical therapy comes in, they're not noting these things. If occupational therapy comes in, they're probably not noting these things either. Speech therapy, definitely not. Respiratory therapy, definitely not. Progress notes. Well, physicians are the one who do progress notes. Would this be written by a physician? No, because a physician's the one who's going to give the discharge orders. Physician is not going to be changing the dressing on the arm. That's going to be nursing, odds are. The physician is not necessarily going to note the fact that the patient had a shower and that they ate 2/3 of their meal. So it has to be nursing notes. When you think about who would be documenting all of this stuff, it's got to be nursing. All right, so that is it. I will credit 8 points to everyone for question number 1, half credit to anyone who got number 13 wrong, 1 point to anyone who got number 33 wrong, half credit point or a half point credited to anyone who got 38 wrong, and a half point credited to anyone who got 40 wrong. And that will be the chapter 4 situation. All right, I hope you're doing well. I'll be back soon to talk to you hopefully about other happier things. But you can look forward to these changes being made, I would say, by the 28th. All right, take care.